So I'd like to congratulate our colleague Salina Martelli to be chosen as one of the 10 most influential researchers in 2016. And I'm very honored to be part of the team that produced the article that led to this recognition. This is actually still a preliminary report that we confirmed the association between Zika infection during pregnancy and congenital disease, especially microcephaly. Salina was the epidemiologist in this study, and I was coordinating all the lab and work and diagnostic related to dengue and Zika, so to be able to make this association. So we found presence of Zika antibodies in the CSF and serum of babies that had microcephaly, but not as much or not as often in the control group that were babies that were born in the same maternity within the same day but didn't have microcephaly. So this was the first official confirmation of the association between Zika infection and microcephaly. We had several clues before this article came up. Actually, the aggregate of information was considered sufficient, but was not a formal proof. In this article, even with in that moment, with 32 cases and 64 controls, were the very first prospective study on microcephaly in Zika. The study started in January. This study was with the individuals recruited until May, and then we closed the article for publication. The full results with 100 cases and 200 controls should be coming out early this year in 2017. And reiterate or corroborate what was found in the preliminary